November 14th is World Diabetes Day. The International Diabetes Federation announced November 14th as World Diabetes Day to increase awareness about diabetes and to educate the patients and their caregivers about their condition. For people without diabetes, is it possible to prevent diabetes by modifying their diet? For people with diabetes, will they be able to manage their disease just with diet? For people who take medications and insulin, will they be able to reduce medications and stop insulin by changing their diet? We will discuss what factors determine the treatment and prevention strategies in this video. I am Dr. Bharati Raju. I have been practicing endocrinology for the past 20 years in United States. Most of us, when we are healthy, we do not think about our diet and lifestyle. Once we go to a doctor and get a diagnosis about a disease, we start thinking about how to change the diet and how to reduce and stop medications. If we have to prevent the disease diabetes or manage the disease diabetes with diet, we need to understand how our body works. Our body makes two hormones called insulin and glucagon. Insulin helps to reduce sugar and glucagon increases blood sugar in blood. When these two hormones goes out of balance, a person gets diabetes. What are the reasons for these hormones to go out of balance? Main reason is genes, genetics. Research shows that there are 70 different genes that are associated with type 2 diabetes. When we talk about genes, we automatically think the genes we got are from our parents. That's why many of us wonder why we got diabetes when we don't have any family history of diabetes. There are changes that happens to our genes starting from when we are in our mom's belly. These are called epigenetic changes. These changes can happen due to any number of modern day factors like stress, smoking, environmental factors like pollution, malnutrition, dietary changes, lifestyle changes. Because of these epigenetic changes, the hormones insulin and glucagon balance gets affected. So, how long does it take for these hormones to go out of balance? Will I get diabetes by eating bad or not exercising for a year or two? Not really. A person has to be in a particular kind of lifestyle for 5, 10, 15 years before these hormones go out of balance. We need to understand the relationship between these hormones and blood sugar levels. Once we know that, we'll be able to understand if we can manage the disease with diet, exercise, or if we need medications and insulin to control the blood sugars. For a person who's at risk of developing diabetes, because of genetic factors or lifestyle changes, their insulin levels go down slowly for many years. And when it reaches below a critical level, their blood sugar starts rising. So when a doctor tells a patient that they have diabetes, their insulin levels are already lower than normal. For any patient, whether they can manage their disease with diet, oral medications, or injections, is determined by their doctors taking these hormone levels into consideration. In future videos, we'll talk more about the disease diabetes and how to manage it. If the information provided was useful, please do share and subscribe to our channel by pressing the bell button if you would like to get notifications about our future videos. Thank you very much.